I'll define social determinants of health. Social determinants of health are the conditions and environments in which people live, learn, work, worship, play, and age. So there are 5 areas that these conditions reflect the available resources in addressing. I'm going to go over each one in turn. Economic stability, healthcare needs, neighborhood environment, social and community context, and quality education. What's really interesting about social determinants of health, none of these conditions operate in isolation, in a silo. Like, for example, if someone is not able to complete their high school education, they might not have the economic ability to change the neighborhood in which they live. So they all are connected to each other. And so it's important when we think about this, because we know that it's not just biological determinants that reflect someone's health or shapes someone's health, it's these social determinants of health. So I'll start with the economic stability. When we think about economic stability, we can think about work hazards. If someone has to push or lift heavy things, that can impact their health. We can also think about poverty in terms of the access that they have based on their income level. And when we think about income level, that impacts their housing stability, but also food insecurities. If we think about certain neighborhoods, there might not be full service supermarkets. You might see more convenience stores. So if you see more convenience stores, the quality of food is not the same as a full service supermarket. The prices are higher. And so that impacts someone's health as well. That's that concept of living in a food desert. And when we think about employment, it's not just having a job, but it's even the possibility of the type of job someone has and the idea of being underemployed. When we think about health and healthcare needs, someone's health literacy is very different than their overall literacy, and their health literacy plays a role in what they're able to understand when they see their physician or primary care practitioner. And we can also think about that idea of access to healthcare and access to primary care. Because when we think about health and healthcare needs, we're thinking about the quality of care that a patient has. We're thinking about the competency of the practitioners taking care of patients in terms of their linguistic needs or in terms of meeting them where they are at. We also can think about the neighborhood and the environment. We can think about the quality of the housing. We can think about if there's crime or violence in the community. When we think about safety, we encourage our patients to exercise, but if it's not safe for them to go to their local park, it is hard for them to exercise outside. That's the walkability of someone's neighborhood. And there's a quote that I think is very telling, and it says, "A person's zip code can be a stronger predictor of a person's health than their genetic code." And I believe that to be true. And that is going along again with those social determinants of health. And when we think about the social determinants of health in terms of someone's neighborhood and environment, we're also thinking about transportation. When I worked at the community health center, many of my patients, it was hard for them to come see me as their primary care provider because of lack of transportation. So all of those things, again, play a role in the social determinants of health. When we think about education, we can think of early childhood education. I'm a mom, my daughter's 15. And when I think about early childhood education, many of us as parents know that preschool years or the 0 to 5 years really play a significant role in the development of someone's education. In addition, that is also the case in terms of someone's health. So in terms of early childhood education, I'm going to read this statistic. By the mid-30s, 30 years of age, children who participated in comprehensive early childhood development and education programs had a lower risk of heart disease and associated risk factors like obesity, high blood pressure, blood sugar, high cholesterol. So that's that idea of early childhood education impacts adults as they age in terms of their health. Also enrollment in higher education, graduating from high school, and then overall language as well as literacy. Social support is so important, thinking about social and community contexts. When we think about that idea of belonging to a group, we don't feel as isolated. We know mental health is so important in terms of support for anxiety, depression, and overall well-being. And we know also that incarceration, discrimination, I'm going to talk a lot about discrimination, incarceration also impacts our health. So these are all of those social determinants of health, those 5 areas that I showed on the initial slide that impacts and shapes someone's health. Of late, we've been talking more about racism. Racism as a social determinant of health. So it wasn't on the initial slide, but I want to make sure I go over it in detail. We can think about structural racism, and we can think about interpersonal racism. Structural racism, you can think of it as a lifetime racism, being treated unfairly based on someone's race. Interpersonal racism is the everyday racism that one might face in terms of different service at a restaurant, in terms of people approaching me differently because I'm African American. So structural racism, it's the key ways like education, employment are structured to advantage the group in power and disadvantage racial and ethnic minorities. Interpersonal racism operates through individual interactions, where an individual's explicit or implicit racial prejudice restricts equal access to the key areas of those social determinants of health. And that's why we're talking more and more about racism being a social determinant of health, because racism is associated with poorer, not only mental health, but also physical health.